Good evening, everyone. Good evening, delegates. Thank you for joining Shield Connect. And good evening, each doctor who have joined for this new topic, which is stress and infertility. This topic has been sponsored by AMOGS and Aurangabad Obstetric Gynecology Society with Shield Connect. And so the topic is about stress and infertility, how stress is affecting on infertility and how infertility can also leads to stress. So this is the vicious cycle. And on this topic, our three main speakers will speak upon it. But before that, let me start with God's blessing. Om Gan Karpate Namo Namaha. So let me introduce our coordinators. I welcome the coordinators, Dr. Anjali Vare and Dr. Vaishali Surse. So let me speak about Dr. Anjali Vare. Ma'am is president of Aurangabad Obstetric and Gynecology Society, consultant at Vare Hospital in Aurangabad. Ma'am is practicing since last 27 years in high-risk obstetrics and sonography. Ma'am has conducted adolescent health camps in school and college and worked in obstetric in HDU. And now let me welcome our coordinator as well as MOC for the day, Dr. Vaishali Surse. Dr. Vaishali Gaikwad Surse ma'am has done a ICOG fellowship in IVF. Ma'am has also done Foxy USG fellowship, worked at Wadia and Seven Hills Hospital from Mumbai, worked at Medical College in Derwan, Ratnagiri as infertility consultant. Ma'am is practicing since 14 years at MediArts Hospital near Gajanan Maharaj Temple, Garkheda, Aurangabad, and ma'am is Honor Secretary, Aurangabad Obstetric Gynecology Society. So I welcome everyone on this platform and I hand over the session to Dr. Vaishali Surse. Thank you so much.
Thank you so much, Nishant, for the kind introduction. On behalf of AMOGS and AOGS, or should I say Sambhajinagar OBGY Society now, maybe SOGS in the following days, but still some time to come. I welcome you all at the pleasant evening and with a burning topic of stress and infertility. I welcome our chief guest for this session, Dr. Rajendra Singh Pardesi Sir, AMOGS President. A warm welcome to our guest of honor, Dr. Sunita Tandulwarkar Ma'am. I request our President, Dr. Anjali Vare Ma'am, to kindly introduce and welcome our guests.
Good evening, friends. It's okay, Anjali, it's okay.
No, all of you know Dr. Rajendra Singh Pardesi, sir. He has presented 28 papers. Then he has received 7 times Best Paper Award. Then he is AMOGS President. Now our next guest of honor is Dr. Ajay Mane, and Dr. Sunita Tandulwadikar Madam. Dr. Sunita Tandulwadikar Madam, she is the head of the department and chief in IVF and Endoscopy Center, Ruby Hall. She is advisor and consultant of DY Patil IVF Center. Her extraordinary achievements are: she is India's first stem cell baby and world's first at the age of 45.
Anjali ji, thank you so much.
Yeah.
Thank you, dear. Thank you.
Our next guest of honor is Dr. Ajay Mane. He is Vice President-elect Foxy. He is member of NIMC committee and PCP and DT wing. Then he is a trainer of Foxy Adolescent Health Committee. He is Health Advisor, Sports Authority of India, that is SAI. He is Charter President, Rotary Club of Aurangabad Elite. I welcome you all. Vaishali?
Yes, ma'am. Thank you, ma'am. Moving forward to our academic part now, I welcome our chairperson, Dr. Pandit Paraskar sir. I think sir will be a little late, but I'll just introduce him in the meanwhile. He is a well-known and successful gynecological endoscopic surgeon and IVF ICSI infertility specialist. He is always invited as an operating faculty and guest speaker at national and international conferences, India and abroad. Sir has published various papers in national and international journals. His Endoworld Hospital is recognized by Foxy and IH for training in endoscopy and infertility and sonography. I think sir
has joined. Dr. Palaskar sir has joined.
Pardesi sir, he's come.
Yes, ma'am.
Has he joined?
Yes, ma'am.
Nishant?
Yes, ma'am. Dr. Palaskar has joined.
Has sir joined?
Yes, sir.
Yes. Good evening, sir.
Yeah, good evening.
Good evening, sir. A warm
Good evening,
welcome.
Sunita madam.
Good evening, Pandit. Lovely to see you, dear.
Yeah, nice to see you.
You
Madam.
and Kalyan, the incoming president and the future president of IAG. So when she said IAG, I said, "Abhi Pandit ya Kalyan usko correction karenge." IAG, the most dynamic young presidents in the history of IAG.
Thank you so much, madam. You have made taken the IAG to so bigger heights. It's very difficult to match now.
No, it's not difficult. But IAG, our year was fantastic
Right.
because you all were there. And we will be there, sitting in a row of past presidents.
Yeah. Under your guidance, we'll continue.
Good evening, Pandit sir.
Yeah, good evening, madam.
Dr. Sneha Buyar.
Yeah, madam.
So now we invite Dr. Pardesi sir to give words of blessing for the conference.
Yes. Good evening, everybody. Dear Dr. Sunita Tandwarkar, ma'am, our state coordinator, Dr. Ajay Mane, VP elect Foxy, Dr. Pandit Palaskar, Dr. Anjali Vare, Dr. Vaishali Surase, Dr. Sneha Buyar, Dr. Kalyan Baramde, Dr. Jyoti Banglowala. I am feeling proud to be a part of this webinar, our own webinar, our Aurangabad Society's webinar on stress and infertility. I think stalwarts like Sunita Tandwarkar and Palaskar and Kalyan in the field of infertility, I think they will guide better than me. I know stress alone cannot cause infertility. It does interfere with the woman's ability to get pregnant. And research shows that depressions are history of women's having history of depression. They are twice likely to face infertility. I think all the faculties, Dr. Sneha Buyar, Dr. Jyoti Banglowala, Dr. Kalyan, they will guide us and we will enjoy this webinar with this galaxy of faculty and speakers. So I wish every success to Dr. Sunita Tandwarkar, Dr. Sneha Buyar, Dr. Jyoti Banglowala for their future endeavor in Foxy. They are now the leaders of Foxy, future leaders of Foxy. I wish every success to this webinar. Thank you. Thank you so much. Thank you.
Thank you very much, sir. Thank you.
Thank you so much, sir, for the blessings and pearls of wisdom. We all are well versed with the knowledge that increase in stress at all levels is proportionately related to infertility, and it is also the other way around. So here we present to you the very first topic of current infertility issue in India by Dr. Sneha Buyar, ma'am. I request Dr. Palaskar sir to kindly introduce Dr. Sneha Buyar, ma'am.
Yeah, good evening, everybody. Dr. Sneha Buyar, madam, is very well known in Foxy, AMOGS, and she is very close to Aurangabad OBGY Society. She is always involved in the programs, the conferences. CM is organized by the Aurangabad OBGY Society. And she has vast knowledge in infertility. She is a chairperson of breast committee Foxy 29-21. She is a governing council member of ICOG. And so many credits are there. She is a chairperson of medical disorders committee, AMOGS, founder president of Vidarbha chapter of ISOPOC, president of Yavatmal OBGY Society, founder clinical secretary of Yavatmal OBGY Society, and executive committee member of the AMOGS. She has so many publications and she has done so many research activities. She has issued in numerous awards to her credit, and it's a great pleasure to hear from Sneha Buyar, madam. Welcome, madam, and the dais is yours.
Thank you so much, Pandit sir, for that kind introduction, and a very good evening At the outset, I would like to thank the respected Dr. Pardesi sir, AMOGS President. Can you see my screen?
Yeah.
Yeah. So, respected Dr. Pardesi sir, our today's guest of honor, Madam Sunita Tanduladkar, Dr. Ajay Mane, and our dear friend, Dr. Kalyan Baramde, for having me here. Thank you so much, all of you, once again. And I would just start by saying this current infertility issues. As all of us talk about infertility as failure to conceive in spite of 1 year of unprotected intercourse. Nowadays, it's not only the inability to conceive, we are facing a new terminology that is trying to conceive. It is so surprising that procreation being such a natural process in the life, and that for that you have to try hard to achieve or to conceive. And why this has happened so? If you look at the figures, it's almost like a new epidemic in the young India. India is facing almost 22 to 33 million of couples with infertility in their reproductive age group, and they are suffering almost a lifetime infertility issues. 1 in every 4 couple, that is almost 25% of all the couples, they are facing these problems of infertility. They are struggling with their treatments of infertility. More and more younger generation, younger Indians, they are landing up into this problem of failure to conceive. The reasons being various. Lots of reasons they are attributed, though there are certain issues like, their problems with their reproductive system, their hormones, all these issues, but definitely stress, mental and physical stress, the overburden of their job performances, their, issues regarding their emotional stress, what is because of their financial and social instability. Almost 40 to 50% of these cases, they are attributed to problems with women, and 30 to 40% almost to the men. And surprisingly, in India, male infertility is on the rise. So that's a matter of worry. There are many reasons that have been impacted the infertility rates in India, but proper counseling to put the couple on proper track and to improve their long-term compliance, that is the key to success. But because of the population explosion, the fewer centers of IVF, and of course, the time which is needed for counseling, lack of all these factors, in fact, worsens the situation. If you just have a look at these figures, almost 40% is the male infertility and 50% is female infertility. 10% is unexplained. Sorry. So if you have this, have a look at these figures, unhealthy eating habits, the poor unhealthy lifestyle in total, may it be just unhealthy eating habits, the sedentary lifestyle, not being physically active, and of course, to add to this, the mental and physical stress, PCOS, and other annullatory factors. So all these factors contribute to, of course, the lifestyle, which is not only in the eating habits, the others use and abuse of substance, smoking, alcohol, of course, the medical reasons as well, which are associated with their late marriages as well. So all these, contribute to the problems of infertility and further add to the stress. Infertility in India is commonly acknowledged and it is caused by the modern lifestyle. The fast urbanization, hormonal changes, particularly the hyperprolactinemia, job pressures, stress, vehicular pollution, and differing parenting. This, of course, is previously we used to have, the male is financially stable, so there is no problem, getting married and having a child. But nowadays, because of this changing scenario, even the women, they are so career minded, they're trying to defer their age of marriage. At the same time, unless they are self-sufficient, they're not planning for the pregnancy. And that is why deferring parenting also can lead to or contribute to the increasing incidence of infertility. It is, as I have already said, it is because of the lifestyle associated problems, especially obesity, diabetes mellitus, of course, these sexually transmitted infections, which are so very common, leading to blockade of the reproductive tract, polycystic ovarian syndromes, fibroids, genital tuberculosis. These are the various concerns which are adding fuel to the fire. So higher use of contraception, as we have just said, that maybe they get married at a later age, but unless they are stabilized financially, they're not planning for pregnancy and maybe going for more and more use of contraceptives. In 90s, if you have a look at these statistics, the average number of children a woman can have in her reproductive age group was on an average 3.9, that is 4. But now by 2030, it is only 2.3. So the fertility rate is definitely on the decline. And this apparently is because of the increased use of contraceptives and decision to marry late. The rates of using contraceptives and late marriage is on the rise. Recently, there is more number of women and men, they are landing a bit to infertility. So definitely social and financial stability is a matter of concern. If we just have a look at these figures, what is the fertility in male and fertility in female as per their age? 20 to 24, the fertility is almost 86%. By the age of 35, it is 52%. And by the age of 50, it is only 1% for male. I'm sure previously we used to say even 6th and 7th decade males can bear children. But this is the fact. Almost 32% decline in the average sperm count by the age of 30s. So that is the current scenario. For the female, 30 is the age definitely when we talk about decline in fertility as far as the quantity as well as quality of the oocyte is concerned. But here you can see there's a rapid decline in the fertility rate in female after 30, and in near about 50, it's negligible. So lifestyle and environmental factor definitely has a role which acts on every aspect of fertility for male as well as female. For male, decreased sperm number as well as motility. Of course, there is decreased quality of the sperm, abnormal shapes and morphology, blockages of the reproductive system because of the STIs. For female also, ovulatory dysregulation, dysfunctions, hormonal imbalance, and of course, blockages of the fallopian tubes. Of course, because of the increasing incidence, the increasing age of marriage and bearing children, the comorbidities which are also associated, like diabetes and hypertension. So these are the various reasons which adds fuel to the fire, adding to the number of infertility. So what causes infertility in women? We just have a look at this figure. There are various factors, congenital anomalies. Right from the beginning, if you talk about retrovaginal agenesis, Mullerian abnormalities, to the acquired factors like trauma, immunological factors, urogenital infections, may it be simple pelvic inflammatory disease, tuberculosis of the genital tract, various types of STIs that lead to adhesions, blockage of the reproductive system, and of course, endometriosis and endocrine disturbance. And because of this mental and physical stress, you may have various, various number of the unexplained infertility as well. So what causes infertility in men? As for the female, we have various factors for the male as well. You can have congenital reasons like cystic fibrosis, genetic problems, antecedent testes, and vas agenesis. We can have acquired causes like damage or injury to the reproductive system. We can have various kinds of infections, STI, especially blockage of the epididymis and epididyma or cutis, or blockage of the vas as well. And of course, because of the overexposure of certain medications or chemicals and radiations leading to DNA fragmentation, that can add to the risk of infertility. Environmental factors, smoking, hazardous levels of alcohol, intake of heavy medications like antibiotics, antihypertensives, frequent exposure to heat like saunas and hot tubs, varicocele, which is a quite a common clinical condition, which because of the temperature, there is definitely impairment in the sperm function as well as a sperm number. Diabetes, hyperprolactinemia, and other endocrinological problems definitely add to the risk of infertility. Premature ejaculation may cause problems in reaching the sperm to the destined level, the destination site. Azoospermia, may it be true azoospermia, maturation arrest, or because of blockage of the vas. All these will add to the infertility of male. So how does this smoking affect? Smoking definitely affects sperm quality as well as number. It leads to decrease in the number of sperm count. It leads to abnormalities in the shape of the sperm. It also decreases the motility, and of course, it increases the pH of the seminal fluid. So definitely, smoking has got hazardous effects on the semen parameters. Environmental parameters or pollutants, as we talk about the endocrine disruptor chemicals, that also we need to blame for dramatic drop in the fertility. Almost 3 in 4 Indians breathe toxic air, especially when we talk about the northern states, Delhi, UP, Bihar, Haryana. All these cities, they have a very high pollution index, almost, that is, it is almost 10 times, the pollution is 10 times higher than what is recommended by WHO. Air pollution does not only lead to the premature deaths or heart diseases, but it also affects fertility and the birth process. It is associated with infertility, birth complication, increased birth defects, and the stillbirths also. So air pollution definitely affects the semen quality and of course lead to infertility as well. Endocrine disrupting chemicals, as we have already talked about, the routine ones which are there are around us in day-to-day practice. It's almost the bisphenol A, DDT, which was previously used as insecticides, dioxins, heavy metals like cadmium, mercury, lead. All these can affect fertility, and phthalates, which are actually used in production of plastics. So all of these can have their effects. Men who are doing long standing or sitting jobs, who are working at a factory or at a high temperature around them, they definitely have infertility, because as a their occupational hazards, we can say. Smoking, alcohol, as we have already said, it does affect the fertility. Women in their 30s, they have egg reserves closer to their 40s. Previously, we used to say it is, decline in fertility maybe after 40, but nowadays 30 itself is the age where you have drastic decline in the fertility as far as the number and quality of oocyte is concerned. There's increased incidence of polycystic ovarian syndrome, as we can say, some quote it as 6 to 8%, but Indian studies say the PCOS incidence is almost 30%. Yeah, and what we are diagnosing is just a tip of iceberg. So according to Gani, who heads the Indian Council of Medical Research, he says that this is prevalent in men also. So the men who are, little obese, they have gynecomastia, they have baldness. So these are the men who are also suffering from PCOS. Recently, we heard a talk by Dr. Durusha at ICH Mumbai, and she has also thrown light on this issue of PCOS in men. So definitely rising incidence of diabetes and of course the associated problems is linked to PCOS in men as well. So what we are talking about is stress, uh, the lifestyle, definitely what food we have, what atmosphere we live in, and the mental and physical stress. Definitely, it has impact on your ability to conceive. So, just before starting the talk, I have just said the procreation is, which is actually a natural process, but here people have to actually try to conceive, which adds further stress to the whatever you want to have the treatment. If you take it happily, if you follow it happily, and you may just conceive naturally. That is what we are also telling our patients. So sometimes a peaceful and relaxed intercourse is all that takes it to get pregnant. But given our lifestyle and the heightened levels of the stress that brings forth even the simple process to be very eluding and very stressful for most of the couples. So rightly said, stress leads to infertility, and because of this inability to conceive, there is further stress. The cycles and cycles of infertility treatment, follicular study, and the various procedure the couple has to go, so gives them a mental as well as financial torture, and that's a very reason that increases their stress. So definitely you have to conceive this couple properly. So just to summarize, we have this infertility, which is very, very related to not only the genetic factors, but also to lifestyle factors. So genetically, of course, we have said that there are certain genetic problems, chromosomal abnormalities, virulent anomalies that can lead to infertility, but lifestyle factors like advanced maternal or paternal age, drugs, smoking, pesticides, sexually transmitted infections, and stress that leads to infertility. And infertility further leads to the stress, or puts the patient and the couple at stress, because they are going through a vicious cycle and they're going through instability, financial as well as the social instability that leads to further sadness, anger, depression, and worsening of the situation, further adding to the stress. So definitely, I think proper counseling of the couple, triaging them, treating them in a proper way, and of course, explaining them from time to time, relaxing them should help in the management of infertility. And this stressful situation we can overcome by, stabilizing the couple. We can't help them financially, but definitely we can definitely relax them and help them in their conception. So infertility affects both men and women, as we already discussing the age of female partner and duration for which the couple has been trying for baby. These are the two important factors for infertility diagnosis. Late marriages, also deferring parenting, it's on the rise, and that's what is leading to this stressful situation. So I think what we have to say that we have to really help them out to relieve their stress, and I think guiding them in a proper manner, at the same time relaxing them mentally should help them conceive. So with this, I stop here and stop sharing also. Thank you so much for giving me this opportunity, and thank you for your patient listening. Thank you so much.
Thank you so much
Thank you, Chairperson.
for the detailed and very practical tips for resolving the issue. I request Dr. Pandit Paraskar sir to please give the concluding remarks. I request Dr. Anjali Vare ma'am to kindly give the concluding remarks.
It was a very informative talk, Sneha madam. You have covered almost all, and nowadays we are seeing that this stress is leading to the increase in the incidence of infertility, mainly use of this mobile, then use of fast food and all. And we are regularly seeing these patients, and if they control all these things, we are getting results also. Thank you, madam. Thank you, Sneha madam.
Thank you so much, madam.
Good evening.
Hello. Good
Good
evening,
evening, Sneha
Ajay.
madam. Good evening.
Good evening. Good evening.
I'm so sorry. I was traveling basically.
Good evening, sir.
अपना webinar, अपना traffic.
Traffic, okay.
भिजून आलात का सर?
ज्योती मॅडम नमस्ते.
पावसात भिजून नाही आलात ना?
नाही गाडीत होतो पण ट्रॅफिक मध्ये अडकलो.
औरंगाबादला पाऊस सुरू झालाय कारण.
नाही जस्ट रिच हॉस्पिटल. So I'm very much thankful to Infertility Committee, AMOGS and Shield Healthcare, particularly Nishant Bhai. Thank you very much, and thank you Kalyan Bhai, Jyoti Madam, and Neha Madam, or always academic stars from our fraternity. Thank you very much for participating here. So everybody is eager to listen your lectures. I'm not going to waste your time. So best luck to all of you, and thank you very much. Thank you Anjali Madam, and thank you Vaishali Madam to incorporate me in this webinar. Thank you.
Thank you so much. Thank you, Ajay. Thank you, Kalyan. Thank you. Thank you for the invitation.
Thank you, Dr. Sneha ma'am. Welcome, Dr. Mane sir. Moving forward to our next topic by Dr. Kalyan Barmade sir, of stress and its impact on infertility. Dr. Kalyan Barmade sir is a chairperson of Public Awareness Committee FOXY 2019 to 22. He is the Joint Secretary IH. He is the convener of Mission Save the Uterus FOXY 2019-22. He is the executive member of MSR. He is the chairperson Infertility Committee AMOGS from 22 to 24. He is the president of IMA Latur 22-23. So a warm welcome to you and eagerly waiting to listen from you.
Thank you, ma'am, for such a good introduction. Now I'll start my screen. At the outset, I'd like to thank Aurangabad OBGY Society, both president and secretary. Also, my respected Dr. Pardesi sir, Dr. Tandurkar madam, Dr. Ajay Mane sir, and Dr. Sneha and Dr. Jyoti ma'am. So my topic will be stress and impact on fertility. Stress, can it cause infertility? There's always a question asked by the patient whether they are really going to have infertility only because of stress. So stress affects fertility, but people were unable to discover why and to what extent it causes infertility. Am I infertile because of too much of a stress is a common question. Why can't I find anything in the house and I'm always irritated? This is the second question. And why I'm fighting daily with my husband? It's all related to the stress. And stress is the reaction people have to excessive pressures or other types of demand placed upon them. It arises when they worry that they can't cope up. Our body's physical and emotional reaction to circumstances or events that frighten, irritate, confuse, endanger, or excite us. So stress is a part of life. The good news is that stress can be self-controlled. Stress prepares a person to react to the causing event or stressors. Positive correlations have been found between physical fitness, social support, emotional well-being, and health outcomes. Nurturance is another factor that affects the way people handle stress. So it's a personality who decides how you are going to handle a stress. So even that implies for the infertile couple. If you counsel them that the success rate of ovulation induction and planned relation is only 8%, IUI success is 15 to 20%, when you are using HMG, and IVF success rate is 40 to 50% at international standards, they will start accepting that. So you need a good counseling for the patient so that they don't get stressed up because of the infertility. What are the stressors commonly known to us? They can be physical, psychological, or social stressors. Physical stressors are always external factors. Psychological or strong emotion can be brought on by external or internal factors, and social are caused by interaction between two individuals or the environment where she is living. What I mean is social is because she may be stressed by the expectation of the family or by the expectation of her in-laws to have a baby and not to have infertility. Also, expectation of her mother and father or family is very important, and they might get stressed because of that. So we got a response to the stress, whether to fight or flight. So your heart rate becomes faster, your blood pressure rises, breathing becomes rapid, hormones as adrenaline increases, senses become more efficient, muscle become tense to enhance the movement, blood flow increases to muscle and brain, blood flow decreases to organs, hands and feet. Perspiration increases for improved cooling. That's what will be seen in a patient who is really stressed out. So we'll go to the one by one factors that are called symptoms of stress, psychological symptoms. They can be intrusion, there can be a negative thought or mood, they can be dissociative symptoms, or they can be avoidance symptoms. They might be avoiding all the family members. The physical symptoms like palpitation, chest pain, difficulty in breathing, and even nausea and vomiting, fatigability, stomach pain, intense headache, and perspiration or sweating can be there. We need to know what are the behavioral symptoms that comes because of the stress. There can be a smoking, alcoholism, biting of the nails, disturbed sleep, or eating too much or eating too less. And that is what are the behavioral symptoms which can have negative impact on certain effects of fertility. And that's how they can become infertile. Stress can lead to infertility. And stress can be there in both male as well as female. There can be affection like sexual dysfunction, hormonal imbalance, sperm count motility and structures are altered, disturb the menstrual flow and cycle. Stress may also affect implantation, and stress can negatively affect IVF outcome and also recurrent implantation failure. So being diagnosed with infertility, everyone reacts to the diagnosis of infertility differently. Some say, oh, that's fine. I'll get baby within next 6 to 12 months because I am with a good doctor. Somebody says, oh, I can't become mother or I can't become father, and they might go into a depression. So diagnosed partners can experience several emotions like shock, surprise, or even denial. So many times we get so many patients with reports of azoospermia where they go into a denial mode, a sense that diagnosis is not. This can be also described as feeling numb or not knowing what to do next. And that's what comes anger or frustration. This can be expressed as why this is happening to me only, or maybe feeling angry at others or even partners. So anxiety, fear or panic, all thoughts are very confused. Some couple might go into isolation, feeling different from others that they can't be a parents, or feeling out of touch with your partner, and that's how causes again infertility. Sense of loss. There are many aspects of grief covering loss of pregnancy, loss of motherhood, and loss of fatherhood. These can continue through all stages of infertility. So now we are going to go to each stage. What are the effects of stress on fertility factors? Infertile patients respond to the stress of being unable to conceive by aggressively pursuing treatment and procedures. Patients withdraw and isolate from family, friends, and community. And most people who cannot get pregnant have an actual physical explanation. But as month after month goes by, feeling of stress, anxiety, and depression often kicks in because the time is past and they are not getting fertility. So what are the impact of stress on fertility? Even if the physical cause of infertility is treated medically, say surgery for endometriosis or tubal block, problems with low sperm count and others, it's possible that high levels of stress can still make getting pregnant more difficult. Infertility causes stress which is aggravated as time passes and couple remains infertile. Couples who are participating in IVF program are the most stressed one, especially after failed IVF cycles. Stress in IVF procedures, that is taking time off from work for doctor appointment, long queues in the hospital which are running good, having blood drawn, having routine pelvic examination or ultrasounds, too many injections to be taken in IVF, timing of intercourse in IUI or planned relation, and various diagnostic procedures like endometrial biopsy or HSG or histolaparoscopy. And the most important, because so many of the infertility treatment are not covered under insurance, they are always worried about the cost factor, which remains the most important factor for the stress in rural community of India. So stress and male infertility. What does stress cause? Oxidative stress causes sperm damage, sperm DNA damage, causes number of motility and morphology impairment, causing male infertility. There are other factors also like low fruits, high temperature, occupational hazards, high fat intake, coffee, or even low physical activity might add to this oxidative stress in a male factor infertility. So what are the problems which occur whenever there are stress on semen parameters? According to the American Society of Reproductive Medicine, infertility affects men and women equally, and semen quality is a key indicator of male fertility. Men who feel stress are more likely to have lower concentration of sperms in their ejaculate, and the sperm they have are more likely to mishappen or have impaired motility. It may trigger the release of steroid hormones called glucocorticoids, which in turn put blunt levels of testosterone and sperm production. Another possibility is oxidative stress, which has been stress act on the adrenal glands, causes increase in the glucocorticoids and increase apoptosis and cell cycle arrest, which causes decreased spermatogenesis or spermatogenesis, and it causes decrease in the sperm concentration. So does stress cause problems with the oocyte quality? Yes, it can. Environmental changes, pressure and demands, and several other factors generate psychological stress. The psychological stress induces lifestyle changes and cortisol production from adrenal gland, which directly and indirectly affects the ovarian physiology. The lifestyle changes, including alcohol consumption, smoking, leads to increased levels of ROS. Increased levels of ROS results in oxidative stress, as everybody knows. The increased cortisol as well as oxidative stress level affects granulosa cell function, possibly by inducing apoptosis. The granular cell apoptosis results in reduced estradiol 17 beta biosynthesis in the ovary, which reduces growth and development of follicular oocyte and induces something called as cell atresia, that is apoptosis. The apoptosis deteriorates oocyte quality, leading to poor reproductive outcome in the mammals, including the humans. So this is a pictorial diagram of stress and oocyte quality. As you can see, pressure, environmental factors, lifestyle modification causes stress and increases ROS. ROS, in fact, acts on the oxidative stress, causes granular cell apoptosis, which causes also increase in the cortisol and deterioration of oocyte quality and poor reproductive outcome. So when you talk of the sperms, oocyte, you need to talk on endometrial receptivity. The human endometrium plays a vital role in providing the site for embryo implantation and maintaining the normal development and survival of the embryos. Recent studies have shown stress is a common factor for the development of unexplained reproductive disorder. The non-receptive endometrium and disturbed early maternal-fetal interaction might lead to infertility, including the repeated embryo implantation failure and recurrent spontaneous abortion or late pregnancy complication, thereby affecting quality of life as well as the psychological status of the affected individuals. The impact you can see, stress causes HPG axis disruption, that is GnRH decrease and FSH increases. It acts on the ovary, that is E2 and progesterone altered, causes lower GnRH level, lower FSH to LH ratio, altered secretion of E2 and progesterone, which can act also stress, which can stress mediator in the human endometrium, can cause human endometrial dysfunction, causing recurrent abortions. Are there any psychological stress and endocrine hormones? As you know, hypothalamus releases corticotrophin releasing hormone, which acts on anterior pituitary, which releases adrenocorticotrophin hormones, which acts on the adrenal cortex, which release cortisol. And that is how HPA axis is disturbed whenever there is a psychological stress. Stress can interfere with reproductive function at all levels of reproductive axis, inhibit sexual desire, reward, and mating behavior at the brain level, especially in the ventral tegmental area, interfering the release of GnRH pulse generator in the hypothalamus, as well as LH and FSH release from the anterior pituitary. Studies have revealed that acute stress can inhibit the HPA axis by inhibiting the secretion of GnRH, thereby inhibiting the release of pituitary LS. So that's how stress can have impact on the libido. When a lot of problems keep coming up, our HPA axis gets activated to try and help us cope with the ongoing stress. And activation of HPA axis results in increase in the cortisol level, which raises our blood sugar level and blood pressure and inhibits our immune system. High cortisol levels are linked with anxiety. Cortisol also inhibits testosterone, the primary sex hormone, which is responsible for libido or sex drive, and might contribute to the blood flow changes that cause an erection. So it's very important factor for the male who are being advised ovulation induction and planned relation to decrease their stress for normal copulation process. The last point is stress and menstrual cycle. As everybody knows, the higher stress, higher cortisol. Higher cortisol, decrease GnRH. Decrease GnRH, decrease FSH, and ovulation gets disrupted. As a result, estrogen and progesterone and testosterone production gets disrupted, and that's how they can have a menstrual problems. The psychological impact of infertility is depression, anxiety, and distress. The medication used to treat infertility, including clomiphene citrate, leuprolide, and gonadotropins, are associated with psychological symptoms such as anxiety, depression, and irritability. The further into treatment patient goes, the more often the display symptoms One treatment failure had significantly higher levels of anxiety, and patients with two failures experienced more depression when compared without a history of treatment. The impact of stress on treatment outcome. There has been dozens of studies which have investigated the relationship between psychological symptom prior to and during ART cycle, and it has been observed that more distressed women prior to and during treatment, the lower is the pregnancy rate. Women in the highest quality of women in the highest quartile of alpha amylase levels at baseline were twice as likely to subsequently experience infertility, and cortisol measurement is important factor that match the psychological symptom have a negative impact on fertility. And ACOG has said about a patient who experiences a pregnancy loss suffers from post-traumatic stress disorder, which leads to anxiety and depression. Repeated failures, the patient, sometimes some patient will get pregnant quite easily from ART conceiving on their first cycle itself. However, that is only 40%. For others, it may take months or years or may not happen at all after 3 to 4 cycles. The cause of infertility is not always clear. It may be an underlying health condition such as PCOS, endometriosis, or male factor, or frustrating diagnosis of unexplained infertility. Knowing the root cause of infertility diagnosis can reduce the burden, but still it can help. They can place blame on something. Patients with unexplained infertility do not know why they cannot get pregnant. They may become obsessed with the diagnosis. In fact, infertile women may display a high prevalence of obsession. How you are going to cure it? My next speaker is going to talk about that, but I'm going to just highlight certain things. Tell patients to talk to their partner often. They should know, remember, you are not alone. There is a counselor, there's a doctor, there's a treating ART consultant to help you, and your partner is there always with you. Talk to the people with infertility through individual or couple counseling or newly coming up support groups on social media. Read books on infertility so that you know what is the actual chances of conception. Stress reduction techniques such as meditation, yoga, progressive muscle relaxation, or even acupuncture might help. Avoid taking too much of caffeine or other stimulants, and exercise regularly to release physical and emotional tension. There are so many international studies or research articles which talk on stress management during the ICSI cycle may slow down first embryo cleavage and accelerate embryo compactation. A pilot study. Stress and anxiety scores in first and repeat IVF cycle. Stress level remain elevated at all cycles. Women with lower stress and anxiety levels on day prior to oocyte retrieval had a higher chance of pregnancy rate. These results emphasize that need to investigate stress reduction modalities throughout the IVF cycle. That is why ICMR has made a psychiatric consultant or psychologist counselor in your clinic as a compulsory thing. These are other studies which show the same. To conclude, stress has a significant negative role on infertility. Stress can cause infertility and have a negative impact in IVF. Infertility treatment further causes stress to the individuals. Stress can cause both male and female infertility. All couples must undergo counseling, must receive safe and effective treatment for stress, and IVF protocol must include anti-stress and anti-anxiety treatment for couple, that is both male and female factors. To end the talk, stress is harmful to the body. It gives rise to many health problems. So it is necessary to deal the stress in appropriate manner. There are ample ways like meditation. Dr. Sunita Madam always talks of spirituality, exercise, enjoying hobbies, living close to the nature, and maintaining healthy and appropriate boundaries helps to elevate harmful effects of stress on the body. Surround yourself with the supportive people and stay away from people who drain your energy. Avoid overwork and take small break intervals during the day to keep stress away. Managing stressful situation are among the ways to stay fit and healthy naturally. I'm really thankful to AOGS for giving me this opportunity to talk on this topic. Thank you so much.
Thank you, Kalyan. Really, it was a very wonderful talk. You covered all the aspects of the stress, how it affects the menstruation, endometrium, hormonal milieu, and the effect on the male partner and overall effect on the fertility. And you also enumerated the ways how to reduce the stress. So thank you so much. And Kalyan is one of the infertility specialists, and he is a very great friend, and he is always there to reduce the stress among all ourselves. So thank you, Kalyan.
Thank you, sir.
Yeah, he not only reduces stress of patient, he reduces our stress also.
Yeah, and in the IML author also and IIG also.
Thank you so much for good words.
Great lecture, Kalyan Dada. Great lecture.
Thank you, Ajay sir, for this opportunity.
Yes, thank you, sir. Thank you very much. Now I request Mr. Nishant to show the corporate video, please.
Yes, sir. Thank you so much, sir, for permitting us to show the video. We have launched a new product, Aura Spa, for stress management. So let me share my screen.
In today's world, stress and anxiety caused by many day-to-day factors lead to infertility both in men and women. Chronic stress and anxiety have negative impact on three pathways.
In hormonal pathway, stress leads to the increased production of cortisol and adrenaline, leading to reduced insulin secretion and increased glucagon production. This triggers glycogenolysis and aggravates hyperglycemia. In men, high cortisol and adrenaline induces Leydig cell apoptosis, decreases testosterone level, and affects spermatogenesis and leads to loss of libido.
In women, it leads to irregular menstrual cycle, induction of granulosa cell apoptosis, affecting estradiol production and oocyte quality, decreasing libido.
Ultimately, the fertility outcome is affected.
In neuronal pathway, there is reduced GABA activity and increased glutamate activity. This leads to failure of stress coping mechanism. Reduced GABA activity leads to inhibition of GnRH and impacts fertility outcome.
In the brain, stress induces the high beta waves, causing anxiety.
High stress impacts different stages like IVF preparation, oocyte retrieval, embryo transfer, and pregnancy test, leading to reduced IVF success rate. Doctor, in essence, an ideal stress solution should work effectively in all the three pathways, be better and safer than benzodiazepines.
Have you ever wondered why after breastfeeding infants feel relaxed, calm, and sleep? It is not because of satiety. It is in fact on account of alpha-casozepine, Lactium, God's natural gift to infants, the natural stress solution. Alpha-casozepine is the original research of Ingredia, France, in collaboration with University of Nancy. In infants with partially developed digestive system, casein is converted to alpha-casozepine by trypsin. Alpha-casozepine calms the mind and makes the infant sleep.
Introducing God's gift to couple. Aura Spa, the oral spa, a calm way to conceive.
Each capsule of Aura Spa contains alpha-casozepine as Lactium 150 mg and L-theanine 100 mg. Aura Spa, the ideal and natural stress solution, acts on all three stress pathways: hormonal, neuronal, and brain waves.
In hormonal pathway, Aura Spa reduces stress-induced cortisol level in 3 hours. Hence, the GnRH is activated. In female, it prevents granulosa cell apoptosis, normalizes estradiol production, and improves oocyte quality. In male, it prevents Leydig cell apoptosis, normalizes testosterone level, and improves spermatogenesis. Thus, Aura Spa improves the fertility outcome.
In neuronal pathway, it increases coping mechanism and GABA while decreasing glutamate activity. Stress levels are significantly reduced and sleep quality improved.
In the brain, L-theanine produces alpha waves and relieves stress and anxiety in 40 minutes. Aura Spa is approved with US FDA GRAS, Korea Food and Drug Administration, AFSSA. Dose: 1 capsule once a day for both the partners.
Aura Spa, God's gift to infants, is now available for couple. Calm to conceive and improve fertility outcome.
Thank you so much for watching this video and giving your valuable time. So I again hand over the session to Dr. Vaishali Surse. Ma'am.
Thank you, Nishant. Moving forward to the last topic, but it is the most important, and like how to manage stress exactly. It is not just for the patients, but I think it is also for us doctors, especially those who do infertility practice, because infertility is very result oriented and 50% of the time it is depressing. And hence, to know all about how to cope up with it, we welcome Dr. Jyoti Banglowala ma'am to enlighten us on the topic. Ma'am, sir, Dr. Pandit Paraskar sir, kindly introduce ma'am.
Yeah. Welcome, Dr. Jyoti ma'am. She is a very dynamic speaker and secretary of Indore OBGY Society. She has published many papers and conducted various educational and awareness campaigns. She is IMA representative for MTP committee Indore. She was a treasurer of AICUG, which was conducted at Indore. And she has so many, she has received so many awards and so many numerous activities she has conducted. She has been invited as a faculty at many national and international conferences. She is a recipient of the prestigious Wonder Foction Award in 2019, recipient of the Indore IMA Corona Warrior Award by the MP government. She is also recipient of the Nari Shakti Award by the IMA Indore branch, and so many. She has got so many awards and she is very active in OPSI. She'll be talking on the management of the stress. Over to Dr. Jyoti ma'am.
Good evening, sir. Good evening, and I am very thankful to Dr. Rajendra Singh Pardesi for the unconditional love and blessing since many years. I remember since 2012 when we are very much affected in the PCP NDT rule. That time, Dr. Ajay Mane sir and Dr. Rajendra Singh Pardesi helped us very much, and I am thankful to Dr. Ajay Mane sir for giving us the opportunity. And very thankful to Dr. Vaishali Surse and Dr. Anjali Vare and my seniors Sneha Bhoyar Madam, Sunita Tendulwalkar Madam, and Ritu Khanna Madam, Pandit Paraskar sir, and our loving Kalyan Barmade sir. And now I will share my screen and just as recap for the previous 2 lectures. Is it full screen now?
No, ma'am. Yeah, now it is full screen.
Yes, ma'am. Now it is full screen.
Yes, ma'am.
It's again and again going to the last slide actually. It's going to the last slide.
You can scroll to the first slide.
Resume slideshow, you need to click now.
Yes, ma'am. Resume slideshow.
Resume नहीं हो रहा है.
सही थी.
So, ma'am, can you close the PPT and
Is it visible now?
Yes, ma'am, but not full screen.
Yes.
Yeah, now
Yes, now it is.
So this is the stress management, and it's a positive impact on the fertility treatment. And as the Kalyan sir and Sneha madam told us, the stress plays a role in the success of infertility treatments, including in vitro fertilization also. And the many patients who are having the serum alpha amylase more in the saliva tested, there is a small study of 320 girls who are going in the infertility treatment. The serum alpha amylase was raised and they found difficult to conceive. And there are 3 more studies about that. There is actually we say infertility gives stress, but basically stress gives the infertility. Being unable to get pregnant when you want to can be a huge source of stress, anxiety, and depression. No one expects patient to approach fertility treatment stress-free. Finding ways to minimize stress while pursuing treatment can help. And there is many type of reaction, as Kalyan sir told us. And there are, this slide is repeat slide, but though it is a very helpful slide. And whenever the first person is the gynecologist, most of the time, either the general practitioner or the gynecologist who can diagnose this couple is infertile. And when she told the couple, you are infertile, though it is a male infertility or female infertility, the first is the shock or denial and surprise. And second is the anger and the frustration, then anxiety, fear and panic, and then isolation. Most of the time, the couple avoids the social gathering. They avoid social gathering, going to neighborhood, going to parties, picnic. Even the work culture is suffered because they not tend to go outside. And then sense of loss. The couple seems to be lost. And for the first few months, they don't see any doctor. Many a time they don't see a doctor, and many a time they aggressively take a treatment. Infertility patients respond to the stress of being unable to conceive by aggressively pursuing treatment and procedure. They straight away, sometimes they go to the infertility specialist and say, "हमें तो IVF baby दे दो. We want to conceive as early as possible." Second type of patients, they withdraw and isolate from family, friends, and community. They don't want to face anybody. They don't want to answer, "आपका बच्चा कब होने वाला है?" They don't want to answer the friends, to society, the party, the gathering. So 2 type of patients we can see. First, who can go straight away to the doctors and say, as early as possible, we want to conceive. And the second, who are isolating from everybody for 2, 3, 4 months. And most people who cannot get pregnant have an actual physical explanation. But as month after month goes by, feelings of stress, anxiety, and depression often kick in. An impact of stress on infertility. Both the speakers told in very much detail about this. For the short recap, even if the physical cause of infertility is treated medically, say surgery for endometriosis problem with low sperm count and others, it is possible that high levels of stress can still make getting pregnant more difficult. Most of the time when we are doing the basic infertility workup, and we just suggest them by doing the ovulation cycle and just giving them the ovulation time period and tell them to go by the natural cycle, most of the time the male partner come and say, "Ki madam, this time we are unable to do intercourse." That female, most of the time she complains about the vaginismus. These are the total impact of the stress for the normal cycle, normal natural cycle, just on behalf of the basic infertility workup. And when we go up to the IUI, then also the couple is, the male partner is also unable to give the sample. The female partner is not able in the mindset to take IUI as a procedure. Infertility causes stress, which is aggravated as time passes and then couple remains infertile. Couple participating in an IVF program are highly stressed, and especially after in a failed IVF. The money constraint, the social causes, the in-laws, the friends, and themselves also, they are not agreeable to this term IVF failure. And then the stress level increases. Efficacy of the reduction of stress before fertility treatment commences. There is substantial evidence that personality dimensions, coping modes, stress susceptibility, and resilience correlate with the IVF outcome. Recent studies indicate that stress increases the dropout rates from the treatment. Most of the time, when they pay for the 3 cycles, but just after one failed cycle, they don't come to the clinic. Psychological interventions such as behavioral treatment aimed at reducing the stress in IVF have shown to be effective in several studies. A recent meta-analysis showed that psychotherapy accompanying IVF also is effective. There are many short-term goals for male and female fertility parameters. Reduction of feeling of helplessness through coping with infertility, changes in sexual behavior, modification of negative cognition as to infertility, overcoming the deficiencies in knowledge about infertility, improving marital communication skills. These are the short-term goals which every gynecologist or every general practitioner should know whenever they first encounter with the infertile couple. 2 main factors appear in the chronic stress that determine what influences the condition and mood state in the couple on their fertility treatment. The first factor is the way in which the person handles stresses in general. You can see during the thorough examination, during the thorough counseling, you can pick up how the particular male or female partner handle the stress. Whenever you say just one thing, you are azoospermic, you are oligospermic. See how is the reaction of this particular point, and then you can tackle him afterwards. If their coping way is less than adequate, stress may become chronic, and the chronic stress affects fertility. The second factor refers to how the person handles the threat to her or his self-esteem, or her or his biological or social value, which results from the knowledge that something is amiss with her and or his fertility. As a result, anxiety and altered mood states in general are common from the moment doubts as to a couple's fertility arise and increase sharply on account of the fertility treatment itself. However, more or earlier attention should be paid to the first factor, as chronic stress is an important influence on the treatment outcome. But we should always emphasize the religious and social beliefs could be the considered markers. Everybody is having the different type of religious culture, social background, even the economical background also matters the most, because whenever you are, when we say you are infertile, the couple may think, अभी कितना पैसा लग जाएगा? सबसे पहला क्वेश्चन द मेल पार्टनर आस्क, अभी कितना पैसा लगेगा, कितना टाइम तक ट्रीटमेंट चलेगा. Sometimes there are male dominating society, and sometimes they say अभी लड़का नहीं होगा तो सास मेरे को घर से भगा देगी. So there are many beliefs, many disbeliefs, many religious, many social beliefs that counter on the stress factor. Establishing the stress level before fertility treatment is very must. A physician other than the fertility clinic specialist usually makes a preliminary diagnosis, and this physician should establish stress levels, and there must be a scorecard. You should have your own scorecard. You are having a code words for your assistant or your colleagues, and you can make your own scorecard for the stress. You can code that patient how much stressed he is or she is. These findings will not yet be affected by the additional stress produced by the visit to a fertility clinic. Your clinic environment also be a friendly environment, and it is not necessary that always you should ask the couple about everything. Your receptionist, your counselor, they should also ask him and making him friendly or her friendly way, and reduce the stress level or judging him in a very close manner, but don't means the patient, the couple should not know you are judging him or her. If indicated, stress reduction techniques should be applied, and after 3 months, stress levels should again be measured with the same questionnaires. If the couple is then referred to the fertility clinic, the fertility clinic again establishes stress levels, this time both psychological and biological, and compares findings with the previous uncontaminated measurements to determine the susceptibility to stress treatment. Whatever you think, whatever you judge, whatever you did with your questionnaire, you can share with your infertility consultant. And if you are having your own infertility setup, you can again reassess this particular findings after 3 months. If levels are still over-established, individual thresholds, another 3 months of stress reduction is attempted. Though we are saying we should give the 3 months, but sometimes patients are in the aggressive mood. They don't want to wait. So you can start the treatment with some teaching about the stress reduction. When stress reduction is obtained, fertility treatment is initiated with concurrent stress management for both. If stress levels remain over-established threshold, the couple should be advised on the increased probability of a negative result of the fertility treatment and should be recommended to continue with the therapy until lower stress levels are attained. However, if the insist an informed consent should be signed. You should always take an informed consent, always tell about their everything, their biological issue, their stress issue, if there is a female biological issue or male biological issue, and if they want to pursue the treatment, if they want to discontinue the treatment, if they want to follow the 3 months regime for the stress reduction, everything should be on the paper. So there is a small chart. First, the diagnosis of infertility, then establish male and female chronic and acute stress level with the validated questionnaires. And if over thresholds, intensive stress reduction techniques for the 3 months, then establish stress level and referral for fertility clinic, then establish male and female chronic and acute stress levels again with the psychological and biological assess. If over thresholds, then intensive stress reduction through psychological and adjuvant therapies like dietary therapies, some medicines, some exercises, and then if the reduction is obtained, then initiate the fertility treatment with concurrent male and female stress management. There are many evidence that support the following three assertions. Infertility causes stress in the couple involved. Infertility treatment also causes stress in the couple involved. Stress may be a primary or secondary cause of infertility. So this is the vicious cycle, as Sneha madam said. Infertility causes stress, stress causes infertility. Infertility causes the stress and stress causes infertility is the good thing. But sometimes stress causes infertility and then again infertility causes the stress. The work pressure, the family pressure, the age dictates, everything causes the stress to the girl or the boy, and that again causes the infertility. So how we can manage the stress? No one expects patient to approach the fertility treatment stress-free. Even the gynecologist who is treating the couple, she is also in the stress all the time. So finding ways to minimize stress while pursuing treatment can help. First, this is the aerobic exercise. We do not suggest the patient to do the weight exercises unless if the patient wants the weight reduction. If the patient is obese, so first tell her to reduce the weight by the aerobic and the weight exercises. But if the patient is lean, thin, and just stress is a problem, then advise her to do aerobic exercise at least for the 40 minutes. It can be done in the gym or at the home or with the friend circle. And now nowadays there is a concept is coming of the group of infertility people, generally made by the infertility consultants. So she can join a group, an infertility group or friends group or any gym. Then sometime listening to the pleasant music, any type of music which patient wants, male or female patient, for the half an hour or 1 hour, some bhajan, some srotas, some stories, or some songs, filmy songs, or some classical music. It will reduce the cortisol level in your body and thus relieve your stress. Meditation for 1 hour. Most of the time we tell patient to join the meditation class, do yoga classes for early morning walk. It also helps to reduce the stress. Fourth is the progressive muscle relaxation. Yoga Nindra. most of the time we heard, and nowadays being gynecologist, we have to tell everything to the patient, and the patient come with the Google gyan. So we should also know everything, though we practice or not, we ourselves practice or not practice, but we should tell patient to do the progressive muscle relaxation, and the yoga nidra is the best method for this. Fifth is the psychotherapy and cognitive behavioral therapy. You need a psychologist, a trained licensed psychologist should be a best person to do this psychotherapy and cognitive behavioral therapy. Sixth is the self-help books. There are many type of books, and they can teach you how to reduce this stress, what things we should do in our day-to-day activities, what type of things we should avoid, what things we do, what things we should not do. These self-help books are very good for the patients. And sometimes some ancient sagas like Ramayana, Mahabharata, is even Hanuman. Many patients come who says कि मैडम मैं रोज थोड़ा सा ये भजन गाती हूँ, मैं थोड़ा सा ये रिलीजियस बुक्स पढ़ती हूँ, थोड़ा whatever religion you follow, वो बुक्स भी पढ़ती हूँ. That automatically reduces the stress because you are stressed on this particular story, this particular Bhagwan or a particular God, and you actually relieve your all stress, and letting your stress is letting down there only. Then talk to your partner. Your partner is also going through the same stress. Both partners are going through the same stress, but they avoid talking to each other. They avoid talking to each other, plus they avoid facing to each other. So you should talk frequently. You should talk, you should advise your patient to talk your partner frequently about your problems, what you are going through, and let down your problems to your partner only. So you can also understand what your partner is facing, and you can tell your partner what you are feeling. Then you should join a support group, like-minded people who either if the infertility specialist make the groups, the patient who are going in the same cycles, they are going in the treatment, they make a group of those people. Sometimes the positive infertility, positive results of those patients, they also teach the infertile couple to do some activities, or they make hope. There are many. Sometimes when we go to the clinic, if some patient is sitting there with their baby, and you feel there is some hope for me also. So there should be a very good support group system made by the infertility specialist or the psychotherapist or the gynecologist also. Think positive. If you think 10 times you think positive, then the stress level also goes down. Avoid taking too much caffeine. There is a recommended, do not take, we actually tell our patient, do not take 200 milligram per day caffeine. So the 200 milligram caffeine means the 5 cup of coffee. So in India, we don't drink too much of caffeine unless the girls doing the call centers jobs or the girls doing the night shifts, they do drink most of the time this type of caffeine. But do be sorry then safe is the goal. Actually, when we say you can take the 5 cup of coffee, the patient says, whenever the result deteriorated, they say, Madam, aapne to bola tha coffee pee sakte. So better to tell them to avoid caffeine and alcohol. Manage holidays with your partner or with your family or with your friends. It can also reduce the stress. In some, I can summarize only the 5 points. We know that infertility can cause stress that lead to anxiety and depression. We also know that stress can make conception more difficult for men and women. While the exact mechanism of how this works is not totally understood because there are only 12 studies on the stress and infertility, it is clear that there is a relationship between them. Finally, it has been demonstrated time and again that stress reduction techniques, when employed on a regular basis, can improve the conception rates. It improves the oocyte quality, it improves the semen quality, and it improves the interpartner relationship. And so the IVF successful rate also come up. Stress reduction is a non-invasive, less expensive and ethically acceptable way of improving fertility. The available evidence dictates that fertility treatment protocol should include stress management and stress reduction as factors of major importance. The professional in reproductive medicine should always test for chronic stress before initiating fertility treatment and adjust selection and treatment protocol accordingly. Relaxation technique can reduce the stress score in infertile women as a complementary and alternative medicine. And thank you. And this new molecule, before giving this particular molecule, when I was practicing in the charitable hospital where the patient cannot afford such medicine, we actually give them melatonin for 1 month. And we tell them, avoid the blue lights, avoid and take your natural circadian rhythm to the base rhythm. So, and take melatonin for 1 month, and most of the time the couple come with the pregnancy successful rates. Most of the time, just sound sleep and regular exercise and regular life cycle, that also give the good result. And I again thank Dr. Ajay Mane and Rajan Singh Pardesi sir, and my co-speakers Sneha Buyar madam and Kalyan Barmane sir for the very nice topic, and Anjali Vare madam and Vaishali Surse. And thank you very much, Pandit Palaskar sir. Thank you very much.
Yeah, congratulations, madam, for very informative and wonderful talk. You covered all the aspects how we can manage the stress in the infertile couple. So thank you so much for your wonderful talk. Thank you so much, madam.
Actually, one thing I want to say, basically I am from Nashik, and ये गर्भ संस्कार वगैरह का जब तक आया नहीं था, now it is in the trend. But we are, since our childhood we are seeing such things कि अभी शादी हो गई, अभी बच्चा प्लान करना है, तो do some yoga, do some religious रीडिंग्स. गर्भ संस्कार का जो अभी एकदम ट्रेंड आया है कि ऐसा कुछ फैंसी चीज है, ऐसा हम लोगों ने सबने बहुत सालों से देखा है कि शादी के बाद जब कंसीव करने का टाइम आता है तो हमारे घर के बड़े लोग बोलते हैं ये सब पढ़ो, ऐसा सब करो. एक्चुअली दैट इज अ नेचुरल वे टू रिड्यूस द स्ट्रेस. आप बार बार इनफर्टिलिटी बोल के स्ट्रेस बढ़ाने से बेटर है कि गिव देम द पॉजिटिव डायरेक्शन. थोड़ा सा ऐसा करते रहने से वो पेशेंट का स्ट्रेस भी थोड़ा कम ही रहता है.
Yes, madam. Rightly said. Thank you so much. Yeah.
Thank you so much,
madam. In this infertility patient, their life just revolves around that infertility only. They just forget to live the life. We should stress on that they should think of other things also, so that stress is less.
Sometimes, madam, वो हमसे ज़्यादा मैंने देख के come with more knowledge than us. मैडम अभी AMH लो है, अभी आपने तो बहुत देर कर दिया, अभी 3 ही महीने हमारे पास, तो कभी
they think that just they will go and bring the test tube baby. Even literate people, they also think like that.
अभी उनको बोलने से कि फीमेल फैक्टर है, तो उसका हस्बैंड बोलता है मैडम लास्ट मीटिंग में तो आपने बोला था कि AMH लो है, जल्दी करना पड़ेगा, अब आप बोल रहे हो साइकिल पोस्टपोन करना पड़ेगा. तो इट इज वेरी डिफिकल्ट टास्क टू एक्चुअली वी शुड गिव देम we should all here there is a trend to tell them to do join a yoga class, do join a gym, and do join a club and relax. थोड़ा होएगा थोड़ा सा.
The couple is revolving around their own problem, and we are also, making them face and go through the same cycle again and again. So I think somewhere we are also adding stress to them. So that's the reason I said it's always better that we inform them that at least 3 to 6 cycles maybe you have to go through, and you prepare yourself mentally. I think that really reduces their stress. That yes, I always tell my patient that, see, if you marry a couple who is married and has everything normal, do they conceive in the very first month? So likewise, they also take, maybe 2 months, 3 to 6 months, or maybe 1 year sometimes. So even if everything is normal, you take 6 months to 1 year. So because you have some problems which needs to be treated, and that will take another maybe few months. So be prepared for that. I think that should help a bit for that couple. I think that's how we can help them out.
Thank you. And now I can see Aparna Singh Rahul also. Hi, Aparna.
Yes. Send me a
Thank
thumbs
you.
up.
Thank you, Aurangabad Society, for giving us
From
opportunity.
Indore.
Thank you very much.
Actually, I'm from Indore. She is my batchmate.
Oh, good.
Okay. Indore Vasi.
Hello. Yeah. Hello, Dr. Aparna.
Hi, ma'am. How are you?
I'm fine. How are you?
Nice seeing everyone around, and very nice topic. Actually, it is not taken like much stress in infertility, like a webinar. It's not taken much, but it should be discussed now. It's a topic of like current discussion. Very nice slides and everything everybody had.
And actually, I'm very thankful to Dr. Ajay Mane sir, who involved me in this Aurangabad Society program. And this is very nicely drafted and nicely crafted program. Thank you. Thank you very much.
Yes, thanks to the entire team. Once again, Dr. Pardesi, Dr. Ajay Mane, Anjali Vare, and Vaishali, everybody, and of course our dear friend Dr. Kalyan. Thanks for my wildcard entry last moment. Thank you so much.
Yes, thank you, madam.
Thank you so much, ma'am, for sharing your experiences and practical knowledge with us. Thank you so much for joining and giving us your pearls of wisdom. Thank you to our chairperson, Dr. Pandit Paraskar sir, our speakers, Dr. Jyoti ma'am, Dr. Sneha ma'am, and Dr. Kalyan sir. We also thank the chief guest and the guest of honor, Dr. Sunita Tandulwarkar ma'am, Dr. Ajay Mane sir, and Dr. Rajendra Singh Pardesi sir. I thank our president, Dr. Anjali Vare ma'am, Aparna Raul ma'am. Thank you for joining. And last but not the least, we thank Shield Connect for taking such a nice topic and introducing the Aura Spa, the oral spa, which really will help us in reducing the stress in infertile couples. Thank you so much for the nice and knowledgeable evening. Thank you.
Thank you, ma'am. Thank you so much, ma'am.
Yeah, I think the very fancy and catchy name, spa.
Yes.
That should really relax, the patient.
नाम सुन के ही आधे रिलैक्स हो जाएंगे लोग.
मेडिसिन नहीं लगता मैम वो,
उसको
कॉस्मेटिक लगता है.
I think this is an old molecule because I was using it before. I think they've relaunched it.
Yes, ma'am. We relaunched this product again.
Yes. We have used it maybe 5 years earlier. Yes.
Yeah, they've relaunched it.
Yes, ma'am. That time we were focused on PCOS, so we have stopped it, and now we relaunched this product again.
I've used this lot.
So, ma'am, what was your feedback at that time?
Now I'll again have to take the thing because this empirical treatment, you can't take out unless you do large studies. Effects you can't tell, but it was a helpful molecule. Like with all adjuvants, I used to this brush.
Actually, there is having no side effects now, Aparna, so we can use. Until and unless there is a major side effect, then only we can wait for the studies. Lithium का तो side effect अभी नहीं है.
No, ma'am. हाँ, naturally ingredient है, so कोई issue नहीं होगा.
ये exactly वैसा ही हल्दी डाल के दूध पी के सोने वाला ही molecule है. Better to give them.
Immunity बढ़ेगा.
Thank you so much. Thank you.
Thank you, everyone.
Thank you, Sneha madam. Thank you.
Thank you.
I heartily thank you, Dr. Mane sir, to organize this wonderful webinar with all the eminent speakers who are presented here. Thank you so much, everyone.